Assalamu alaikum students. Today we are going to start with eyelids, which are one of the contents of the orbits. Eyelids are mobile musculofibrous folds that overlay the eyeballs. The skin fold over the superior eyelid is called suprapalpebral sulcus, and the skin fold on the lower eyelid from the infrapalpebral sulcus. The eyelids protect the eye from injury and excessive light by their clay. The upper eyelid is larger and more mobile than the lower one. Palpebral fissure is the elliptical opening between the eyelids and is the entrance into the conjunctival sac. They meet each other at the medial angle and the lateral angle of the eye, also called canthai of the eye. The more rounded medial angle is separated from the eyeball by a small triangular space which is called lacus lacrimalis, in the center of which is a small reddish yellow elevation called lacrimal caruncle. There is also a semilunar fold lateral to that caruncle is called plica semilunaris. This is a plica semilunaris on the lateral aspect of the lacrimal caruncle. Near the medial angle of the eye, there is a small elevation where the eyelashes cease. This area is called papilla lacrimalis, and on the summit of this papilla there is a small hole which is the punctum lacrimal, which leads into the canaliculus lacrimalis. The punctum and canaliculus carry tears down into the nasal cavity. Each eyelid consists of the following parts. First of all, it has skin starting from the outward. It has skin which is very thin and loose, and the superficial fascia containing the palpebral part of the auricularis oculi. Then the palpebral fascia of the two eyelids form the orbital septum. The thickening of the orbital septum form the tarsal plate in the eyelid, and on the angles of the eye it forms the palpebral ligaments. Here are the lateral and the medial palpebral ligaments. The tarsal plates are the dense fibrous connective tissue, provides structural support to the eyelid, forming the shape of the eyelid, attached to the bony orbital by the medial and the lateral palpebral ligament. The upper tarsal receives two tendinous slips from the levator palpebrae superioris, one from its voluntary part and the one from its involuntary part. The Muller's muscle is the involuntary part of the levator palpebrae superioris, which is supplied by the superior cervical ganglion via sympathetic fibers. Here it is the Muller's muscle. Paralysis of this muscle leads to the partial ptosis, which is one of the part of the Horner syndrome. Talking about the glands, including in the each eyelid, it has the uveic glands of the skin and the mucus glands in the conjunctiva. The large sebaceous Zeiss gland present at the lid margin, which are associated with the cilia or the eyelashes. And the suppurative inflammation of one of the glands of the Zeiss is called stye. The gland is swollen, hard, and very painful. Then we have modified sweat glands or the Mohs gland, closely associated with the Zeiss gland. Then we have sebaceous or the tarsal glands present in the tarsal plate, also called meibomian glands. Clesion is the inflammation of the tarsal gland, causing the localized swelling. Blepharitis is the inflammation of the eyelid, especially the lid margins. The arterial supply of the eyelids are mainly by the superior and the inferior palpebral branches of the ophthalmic artery, along with the lateral palpebral branch of the lacrimal artery. They form an arcade around the eye. The veins drain into the ophthalmic and facial veins. Now the nerve supply of the upper eyelid, starting from the lateral side, we have the lacrimal nerve, the supraorbital nerve, and the supratrochlear nerve, part of the infratrochlear nerve. And from the lower eyelid, starting from the medial side, we have infratrochlear nerve, infraorbital nerve, and then some part by the zygomaticotemporal nerve. Now, our next topic is lacrimal apparatus. Lacrimal apparatus is a physiological apparatus containing orbital structure for tear production and its drainage, and it also protects the cornea and provides some nutrients to the eye. The components of lacrimal apparatus consist of the lacrimal glands and its ducts opening into the conjunctival sac. Then it has the lacrimal punctum, which opens into the lacrimal canaliculi, that goes into the lacrimal sac, and it terminates into the nasolacrimal duct. Lacrimal gland, which secretes the lacrimal fluid with the help of the small accessory lacrimal glands. The fluid moistens and lubricates the surfaces of the conjunctiva and cornea and provides some nutrients. When it is produced in excess, it overflows as tear. It is located in the fossa for the lacrimal gland in the supralateral part of each organ. It has two parts. One is orbital part and other is the palpebral part. Orbital is more deeper and larger than the palpebral part, which is more superficial. The lacrimal gland is intended by the expansion of the tendon of levator palpebrae superioris. The arterial supply is from the lacrimal branch of the ophthalmic artery and drained by the ophthalmic vein. Talking about the nerve supply, we have the parasympathetic fibers, the sympathetic root, and the sensory root. The sensory and the parasympathetic secretomotor fibers travel along the lacrimal nerve, while the sympathetic fibers arise from the plexus around internal carotid artery. The parasympathetic secretomotor fiber arise from the lacrimatory nucleus in the hypothalamus, travel along the nervous intermediates of the facial nerve, traveling along the geniculate ganglion, then through the greater petrosal and the deep petrosal nerve and the nerve to the pterygoid canal, and it goes to the pterygopalatine ganglion. In that ganglion they relay, and the postsynaptic and postganglionic fiber arises through the zygomatic nerve, zygomaticotemporal nerve, and through the communicating branch to the lacrimal nerve, and then it enters into the lacrimal gland and cause secretion. Epiphora is the excessive secretion of the lacrimal fluid overflowing onto the cheeks due to the obstruction in the lacrimal fluid pathway, either at the level of punctum or canaliculi or the nasolacrimal duct. Conjunctiva lining the inner surface of the eyelids is called the palpebral conjunctiva. It is thick, opaque, and highly vascular and adherent to the tarsal plate. It is examined for the anemia and conjunctivitis. The bulbar conjunctiva is the part of the conjunctiva lining the front of the eyeball. It is thin, transparent, and loosely attached to the eyeball. It covers the sclera and it is examined for the jaundice. Now, the space between the palpebral and the bulbar conjunctiva is called conjunctival sac. The excretory ducts of the lacrimal gland convey the lacrimal fluid to that conjunctival sac, and where the both part meets, it forms the superior fornix and inferior conjunctival fornix. Each lacrimal canaliculi begins at lacrimal punctum. It has a vertical part and the horizontal part, and they both open close to each other at the lateral wall of the lacrimal sac behind medial palpebral ligament. Ectropion is the evasion of the lower lacrimal punctum, mainly in the old age because of the laxity of the skin. Here you can see this is the bulbar conjunctiva covering the sclera. This is the angle of lateral angle of the eye. This is the superior eyelid. This is the inferior eyelid. And if you can invert the eyelid, you can see the palpebral conjunctiva. It is examined for the anemia and the conjunctivitis. Lacrimal sac is a membranous sac situated in the lacrimal groove. Its upper end is blind and inferiorly it is continuous with the nasolacrimal duct. It has some relations. Anteriorly or from the front, it has medial palpebral ligament or orbicularis, and medially it has lacrimal groove which separates it from the nose. Laterally, it has lacrimal fascia and the lacrimal part of the orbicularis ocular. Nasolacrimal duct is also a membranous passage 18 mm long, conveys the lacrimal fluid to the inferior nasal meatus as it opens into the inferior meatus of the nose. It has some imperfect valve at its lower end which is called valve of Hasner. Talking about the vessels of the orbit. The arterial supply of the orbit is mainly through the ophthalmic artery, which is a branch of internal carotid artery, and partially from the infraorbital artery arising from the external carotid artery. Ophthalmic artery, if you can see here, is a main branch of the internal carotid artery. It enters the orbit through the optic canal lying infralaterally to the optic nerve. The both artery and nerve have the same duration. Now in orbit, it pierces the dura mater, ascends over the lateral aspect of the orbit nerve, runs forward parallel to the nasociliary nerve, and it goes upward and terminates at the medial angle of the eye by dividing into the supratrochlear artery and the dorsonasal artery. During its course, it gives branches: central retinal artery, lacrimal artery, ciliary artery, supraorbital artery, anterior and posterior ethmoidal arteries, supratrochlear terminating artery, dorsal nasal terminating artery, and the muscular arteries. Now the central artery of retina is very important and a branch of the ophthalmic artery arising inferior to the optic nerve in the optic canal. It pierces the sheath of the optic nerve and runs within the nerve to reach at the optic disc. It gives terminal branches to the internal surface of the retina. These are the only arterial supply to the internal aspect of the retina. These terminal branches are end arteries. They do not anastomosis with any other arteries. So, occlusion of this artery can cause complete blindness of that side of the eye. Lacrimal artery runs forward along the upper border of the lateral rectus along with the lacrimal nerve. It gives branches to the lacrimal gland, give branches in the canal of the zygomatic bone as zygomaticofacial that goes on the zygomaticofacial foramen onto the face, and zygomaticotemporal foramen into the temporal surface of the temporal bone. Then it gives the lateral palpebral artery supplying the eyelids, recurrent venereal branch that goes into the middle cranial fossa, and muscular branches to the muscles of the orbit. Talking about the ciliary arteries, the anterior ciliary artery and the posterior ciliary arteries. Posterior ciliary arteries are long and short that enters near the optic nerve, supplying chiefly the choroid and the iris, while the anterior ciliary artery arises from the muscular branches of the ophthalmic artery. We have the supraorbital artery and the supratrochlear artery. Supraorbital artery supplies the forehead and scalp. Passing through these areas, reach the vertex of the skull. while the supratrochlear artery, it is a terminal branch of the ophthalmic artery supplying the forehead. Ethmoidal arteries, we have anterior ethmoidal artery and the posterior ethmoidal artery. The anterior ethmoidal artery enters the cranial cavity, giving off the anterior meningeal branch and ending into the nasal cavity by supplying the anterior and middle ethmoidal ear cells, the septum and the lateral wall, while the posterior ethmoidal artery supplies the posterior ethmoidal ear cells and the nasal cavity. Medial palpebral artery supplies the median area of upper and the lower eyelid, while the dorsal nasal artery, terminating branch of the ophthalmic artery, supply upper part of the nose, dorsum of the nose, and anastomos with the angular branch of the facial artery. This is also the branches of the ophthalmic artery: central artery of retina, supraorbital, supratrochlear, lacrimal artery, dorsal nasal artery, superior, posterior, short and long artery, posterior ethmoidal, anterior ethmoidal, and the infraorbital. The venous drainage of the orbit is through the superior ophthalmic vein and the inferior ophthalmic. This is the superior ophthalmic vein, lies above the optic nerve, drains into the cavernous sinus, passing through the superior orbital fissure. It communicates anteriorly with the supraorbital vein and the angular vein. This is the inferior ophthalmic vein. It communicates with the pterygoid plexus of vein, passing through the inferior orbital fissure. It also communicates with the infraorbital vein and the angular vein, and it terminates either by joining into the superior ophthalmic vein or directly into the cavernous sinus, again passing through the superior orbital fissure.